Video recording of a fecal float. A fecal float is to test for intestinal parasites. Dogs and cats and other livestock pick up parasites from infected water, infected soil, food, or contaminated animal feces. So like an animal that already had the worms and then they got too close to the feces. Ticks can also cause tapeworm infection in dogs. Is it common or rare? It's very common, and it's vital in finding eggs and parasites depending on how long the cat, dog, or livestock has been afflicted. The most common symptoms are abdominal pain, lethargy, dehydration, vomiting, weight loss, and more nutrition depending on what the cat and dog ingested, depending on the parasite itself. How is this done? The patient will need to provide a sample. You can ask the vet for a fecal container or a dry plastic bag, or even just like a Walmart bag. It'll all do fine, just keep it dry. A fresh sample is preferred to one that's 24 hours old, as this could damage your results and you won't get the results that you want, and only a small amount is needed to actually check for the worms. Tools you will need. The supplies by the vet assistant are gloves, mask, collection tube, tea strainer, microscope, glass slides, centrifuge, float solution of your choice, and a fecal loop. The solution can be zinc, sugar water, or salt water, and all of those ones work fine, so it's up to you. To perform a fecal float, the vet takes a small amount of sample into the container and mixes it with solution. The vet covers the top of a container with a microscope slip and allows it to sit for 15 minutes. During this time, the parasite eggs float to the top and the feces sinks to the bottom. After a few minutes, the vet will collect that top side and put it under a microscope. I included some pictures. Testing your results. Does the fecal float work every single time? No, it does not, and here's why. The biggest reason is that they just won't show up. Either there were no adult parasites and the dog or cat just recently got infected, so no, it wouldn't show up. Or the sample's too old, it might not show up then. It really depends on the parasite too. There's so many different kinds. Treating the pet. Should your pets be infected, here's some name brand and over the generic prescriptions that you can buy. Pranzaquil, ivermectin, Pet Armor, Nutramax, Providable, Pancur, Bear, Orbix, Wormies, Almax, Homeopet, Cystix, Profinder, just a few. Your vet knows. Follow-up treatment. It's likely the patient will need follow-up care. A fecal float is done and it comes back false negative, but sometimes the results are true negative and your dog just doesn't have worms. If it does come out positive, don't worry, just bring the patient back in 2 weeks. Rate and return the animal to the hospital with a new stool sample. If a parasitic infection is suspected and floats are not working, then your vet may recommend other tests such as a fecal wet mount or centrifusion. As a vet assistant, the veterinarian does not need to do it herself, although she can if she wants to. The fecal floats, I can do them myself and send the findings to the doctor or a different staff member.